Hi, Courtney. Thank you for being here today.
Hi, Michelle. Thanks for inviting me.
Can you tell me a little bit about yourself?
So, I am a licensed marriage and family therapist. I have been practicing for 15 years in practice. I've worked in a variety of settings. I worked a lot in the nonprofit world, working with at risk youth and families that were in crisis. And then after that, I transitioned into the military population. And so there I was serving the Marine Corps and also other forms of military, providing therapy and counseling services. And then I've also had a private practice on and off for the last 10 years or so.
Very nice. And what made you become a therapist?
So I always knew from a young age that I liked psychology and I liked helping people. Like I always had like this internal thing that I wanted to change the world.
Mm.
And I thought that maybe I wanted to go into social work. And then just as life progressed and, my path kind of took a different route and I ended up in the therapy master's program. And that just was actually a way better fit. So it's funny how like the universe does that sometimes. It just puts us where we're supposed to be. And so that's a way better fit for me. And it's just been a good fit ever since as far as the differences.
Can you speak to the differences between a social worker? Because social workers do therapy as well. So, what's the
Mhm.
difference between seeing a LMFT, licensed marriage family therapist for social work, and a LCSW, a licensed clinical social worker?
So as far as major differences, I don't know that you would find any major differences as the client. But from just an educational perspective and kind of like our scope of how we see things in general, I can't speak in detail to the LCSW track because I didn't take it, but they're trained in more global issues and more broad perspective and less on the actual clinical one-on-one counseling piece. And then LMFT is we're just solely trained on therapy. So we get a little bit of case management and global stuff, but predominantly it's all therapy and different techniques and theories and different ways to apply them. And so it's just kind of a different lens that we see things through.
And how does someone know that they need therapy?
So that's a tricky question for me because obviously I'm biased. And I'm a big believer in being proactive rather than reactive. So I believe that at any point in your life, even if life doesn't feel bad, you could benefit from going to counseling or therapy for a little bit to kind of give yourself some tools, have a safe space to talk, process some things. I mean, unfortunately, none of us get out of this world unscathed. And so
Mm.
we all have something that we could probably talk about or process or learn some skills from that we may not be able to have on our own. But of course, as human nature, is we don't actually usually do that. We usually wait until we have a lot of symptoms going on. So, of course, at any point, if you feel like any of your relationships are struggling, if you notice you're having difficulty with just day to day life, difficulty sleeping, just not feeling like yourself or how you used to feel, I think that's also a really good point and to get into counseling or therapy so that you can get those skills and work on those things to become happier and healthier and more content with your life.
So, can you speak to the difference between proactive and reactive for those that might not know? Like, what does it mean to be proactive and what does it mean to be reactive?
So to be proactive is to start getting some strengths or skills before the problem happens, with the idea being we will end up with a problem. So, if you go to the gym every single day, the chances of you being out of shape are way less than if you wait till you're out of shape and then you have to kind of dig yourself out of that hole. And so the same thing applies to our mental health or our happiness is if we do some stuff in the beginning, you have to do a lot less
Mm.
then you usually can avoid the problem. But if we wait till the problem comes, then we have to kind of dig ourselves out and then learn some skills to move forward. And so it's not that you can't do that once you have the problem, it's just a lot easier and a lot less stressful if we act a little proactively and get some skills before there's an actual problem.
That makes a lot of sense. So, when someone's in therapy, are they in therapy forever?
No, there's no need to stay in therapy forever. Therapy I think is such an individualized process. that for some people, they may need count therapy for, 6 weeks and they got the skills they needed and they're fine for now. And some people may need it for a couple of years and then they're finally in a better space and they can stop. But the beauty of therapy, I always think of it as it doesn't have to be a one and done. So
Hmm.
even if you go for 6 weeks now and you feel like you're going good, life's good, whatever has happened in your life, and then wham, right? Life happens and
Hmm.
something throws us off kilter. So you can always go back. And same, even if you're in there for years, you can go for years and then take a break and see if you're able to function without it and then go back. It doesn't have to be like all or nothing thought process.
So let's say I go to therapy for a year, then I try life on my own. Then, as you mentioned, wham, life happens and I go back to therapy. Should I go back to the same therapist or should I go try a different therapist? Is one way better than the other?
I don't think there's no one way better than the other because again, therapy is such an individualized process, and like studies show, when we look at studies, is a huge piece of therapy being successful is just like the comfort level and the connection you feel with the therapist, as opposed to like a particular technique they use or a particular theory. And so, if that therapist worked really well for you and you feel like you could still grow with that therapist, I would say return to the one that the one that already knows your history, knows what works for you and what doesn't. If you feel like maybe you've tapped that therapist for everything that you could get from that therapist, or maybe you're looking for something different. Like maybe before you were struggling with problem A and now you're a problem D and you're like, wait a minute, I think I need a new flavor. I would definitely say you could try a new one. I don't think there's any wrong or right when it comes to that, but definitely doing what works for you and what feels good in your gut.
So it sounds like different therapists specialize in different topics. Is that true?
Often that is the case.
Okay.
So a lot of times they'll go to different trainings or get different certifications in different topics, probably of their interests, most likely of what interests them the most. And then they'll, kind of you find your passion, right?
Mm-hmm.
And so when you have your passion, you want to pursue that area more than others. But in general, most therapists can treat a variety of issues.
And what's the difference between a therapist and a friend? Because you mentioned the therapist passion. Should the therapist be talking about like their passion in their life?
No, so in general, a little bit of personalization I think goes a long way, right? Because no one wants to talk to a brick wall who doesn't disclose anything. But
Mm-hmm.
if you find like your therapist is talking a lot about themselves or somehow managing to flip the conversation about themselves a lot, then I think that that's not a good sign. That's probably a red flag because ultimately they're there to talk about you and help you get some skills and help you with whatever you need. Not there to talk about themselves.
What is a red flag?
So a red flag a red flag is something that's concerning, right? Something that maybe this
Okay.
isn't the right fit,
Mm-hmm.
or like something that maybe could even be more extreme, like just a situation that just you shouldn't be in. As far as therapists go, obviously you should always feel safe and comfortable and in a space where you don't feel threatened or judged or anything like that. And you feel like you're there getting your needs met.
And how does someone find a therapist?
So there's lots of different ways to go about it. I mean, a lot of times I'll see it on like mom groups, like who knows a good therapist for my 5-year-old or something like that. Of course, if you have insurance and you want to go through your insurance, you can call your insurance or go on the website and look up providers that are covered under that insurance and then start calling those providers. You can go on Psychology Today and they have a long list of providers on there that have the insurances they take or if they only take cash. Those are also good options in how to find a therapist.
Do you think it's easy to find a therapist?
So right now, I think given the state of our world with the pandemic and all of the mental health um, struggles that we're seeing as a result of the pandemic, I think therapy is kind of at an all-time high, I would say, just based on at least the last 15 years that I've been a part of the field, in which therapists are inundated
Mm.
with clients. And so I would like to say, yes, every time you call a therapist, they'll call you back and at least give you a referral or something. But the feedback that I get from a lot of people is like, I tried, 10 therapists and they're all full or they're not calling me back. And so I would just, suggest you have to have your kind of your patient's hat on and really just be advocate for yourself and keep calling or look for therapists that are open and just keep being open-minded to different venues and avenues for therapy.
It sounds like it takes a lot of work.
It can. It can. I wish I could pretend that it didn't because I don't like that piece of it.
Mm.
I think, of course, if you're ever like in a crisis, a mental health crisis, I think you can call either like your EAP if you have one through your work or your insurance and let them know you're in a mental health crisis, or the Access and Crisis Line if you're in San Diego County. And they can kind of handhold you a little bit more because
Mhm.
due to the nature of your crisis. But unfortunately, it does kind of take a lot of work at this time to
Okay.
find a therapist. I don't know
And
that it's always like that. I think it might just be kind of the time that we're in.
and does therapy take work or should it be easy?
So therapy takes work, right? So when you're meeting with a therapist, at most you're probably meeting once a week for an hour.
Mhm.
And it may be even less often than that, just depending on things. And so, obviously I can't change your life in an hour a week. But
Mm.
what we can do is we can talk about things that might work or that help you look at life differently or find some assignments that you can try at home. But the work happens within you outside of the office. So for instance, if we tried like a mindfulness in the office together and you found it really powerful and really helpful, that's great for that moment. But if you don't go home and try it again or try a different one or try something along those lines, then the effects of it are only going to be that one time. Whereas the power comes from building the habits and trying it at home and doing what you guys talk about in session at home.
Mm.
So it can be a lot of work sometimes.
Yeah. What else do you want people to know about going to therapy?
It's not scary.
It's not
I think
scary?
I always compare it to like, I don't know, I grew up in a big basketball family.
Okay.
And so I always compare it to like the jump ball in the beginning of the game. Like that jump ball, it like produces all this anxiety. Who's going to get the ball? Who's going to get the ball? But as soon as the ball gets in the hands of one team, you just start playing and it's fine. And so I think of it like that, like entering the door of a therapist's office is like the jump ball. It's like
Mm.
anxiety producing. You don't know what's going to happen. But then once you're in the office, you just start having a conversation and it's really easy and it's not hard and it's not intimidating. But just the anxiety of walking through the door, I think, can be the most intimidating part, especially the first time because you don't know what to expect.
Yeah, that unknown piece.
Hmm.
Great. Well, thank you so much for being here today.
Thank you, Michelle. It was so great to see you and thanks for having me.
Thank you.